how well or not a hospital manages transition of care may influence patient adherence to secondary prevention medication post-discharge. And as emphasis of that, let me take you to the hospital variation in adherence to secondary prevention medications after acute MI oral presentation, which was presented by Dr. William T. Wang, who's a third-year medical student at Duke Clinical Research Institute in Durham, North Carolina. And first off, congratulations. I love the NCDR analysis that you did. Why did you do the study, first off?
So we know that medication adherence is very important in improving patient outcomes, especially for patients who've had a heart attack.
Absolutely.
Now, the hospitals discharging these patients after acute MI are really in a position with ample opportunities to improve the medication adherence of these patients. However, it is unstudied whether certain patients from specific hospitals are more adherent to their medications compared with other hospitals.
Well, we know there's a variety of differences in regional variations, and now with the NCDR data, you can kind of focus into specific centers and see where everybody compares.
Exactly.
So what did you do?
So we used a national registry of post-MI patients, and we linked it to their Medicare data. And this way, we were able to obtain information on their adherence, as well as other post-discharge outcomes. And we used these data to analyze the patient medication adherence, as well as what happens after discharge.
So how many patients did you analyze? What was your starting set of people?
We found that there was significant variation across the 459 U.S. hospitals that we examined. The majority of the post-MI patients were prescribed guideline-recommended medications at discharge.
And it was pretty consistent. I mean, you had, if I remember right, about 2/3 of people were on various different drugs.
Right.
And there was only about a point difference. So 2/3 were getting, but that also means that about 1/3 were not really getting appropriate.
Right. Among those prescribed, there was a significant decline in the use of this medication within only the first 90 days after discharge. So that leaves about only 2/3 of patients who remain adherent to their medications.
Which is really depressing, but I mean, what does all this suggest in terms of how to improve post-discharge medication adherence and maybe enhance longitudinal patient outcomes? Because you're showing this obviously a pretty quick dip.
Right.
How do we stop that?
So we found that the hospitals with patients who were more adherent to their medications had lower rates of major adverse cardiovascular events as well as readmissions at 2 years after discharge, even after adjusting for differences in the patient case mix.
So these were the hospitals that did the best job
Right.
with the discharge planning, so to speak.
Exactly, right.
So that certainly argues in favor of better discharge planning as a means of enhancing outcome.
Exactly, right.
Which would seem to be fairly obvious, but clearly it's not getting done.
Right. So, I mean, now that we kind of know that where patients gets discharged or where patients are
Start to fall apart.
Discharged from is actually relevant to how well they are adherent to medications and how well they do in the long term. So the next questions that we need to ask is, what do we need to do to improve adherence for all patients?
Yeah.
What are specific discharge practices that hospitals are employing which
work.
Right.
Versus what's happening that obviously isn't working.
Exactly, right. So we also need to find whether those that work, can we spread it to those that are not as successful.
So are you interested in following up and doing just this kind of study?
Yes, we're looking to do a little bit more research on this.
It should be fascinating, and if you do this and get some more information, could you come back and talk to us again? Because this is a fairly important topic, and I'd really like you to share more that you find from the NCDR. There are 19 different papers that are being presented here at the AHA 2015 from the NCDR data set, whether it be the 5 clinical-based sets or the office-based set of Pinnacle. So please look around. We have coverage in both CardioSource World News and CardioSource World News Interventions. And for those two publications where I'm executive editor Rick McGuire.